And one of the other things that happens when we do this treatment is muscle twitches. Oh.
Yeah.
And oftentimes when it's happening, you're like, oh yeah, it's getting... It's Ian. Hey, it's Coach Renee here, and we are still in Origin's Parkour facility, and we are actually in the weight room right now where Ian here runs some of his physiotherapy appointments. And I am a frequent patient because I do parkour and because I'm pretty messed up. But one of the things that we've been doing recently is we've been doing dry needling, IMS. Does it go by both of those names?
Yeah, they're synonymous for sure. Yeah.
Okay.
Yeah.
And these have both been to treat tendinopathies or tendinitis that I have in two parts of my body right now. So not only am I recovering from knee surgery on one side, I also have some patellar tendon pain on my other knee and some epicondylitis. And the needling itself has done a lot for me, helping with the elbow, but not as much for the leg. But I think that's my fault because I've been doing too much knees over toes, too much of those deep squats,
Maybe.
on the off days instead of some partial range and things that could potentially give it a bit of a load off. That's not your fault, that's my fault. But the elbow's been feeling great, and actually it was after like my first session with you where a couple days after, a movement that would normally hurt that I couldn't do for months, like just getting into a cat hang, was all of a sudden, oh, it doesn't hurt anymore. And I've been able to have a pretty linear progression with it since then. And this will be our fourth or fifth?
I think it's our fourth.
Okay.
Yeah.
All right. So I haven't really even asked you this before. I was just like, oh, it works. You know, he put some needles in my body, and you know, I feel better now.
That's usually how we get informed consent with our clients. Is just jab them.
But we'll talk a little bit, and we'll kind of have this conversation for some of our viewers there too about what is happening when you put the needles in.
There's a couple schools of thought on this for sure. So through the Chan Gun IMS or intramuscular stimulation philosophy, what you have is an overstimulated or oversensitized muscle band or muscle group where the nerve is a little more active because I'd say it's releasing more of a neurotransmitter than it needs to, and the muscle bands are getting tight and stiff and restricted. And what happens in the case of the elbow, so if you have a tendon that attaches here, and this band of muscle is a little tighter, it's putting more strain on this portion. And when you go in and you needle, it sort of releases that strain and tension within the muscle itself. So it has this neuromuscular component. But having said that, the whole mechanism of action is not fully understood. So there's a couple things that are going on, and different schools of thought behind it, basically.
So what would be the difference then between sticking a needle in someone versus manual therapy, massage, foam rolling?
Obviously in one thing you're using a needle, but the idea is that you're trying to get into the tissue to create a neurologic response. And obviously when you do manual therapy, so if you're working on the joints or working on the muscles, it's creating a neurologic response as well as a local tissue response. If it's increased blood flow, relaxation of the muscle itself, sort of lubricating joint surfaces, whatever it might be, there's a neurologic response. However, with the needle, it's fairly, let's say, robust. It's quite big. And the idea is that the nerve pathway is creating this reflex arc, so it comes back into like central nervous system a bit more. You can tap into it a bit greater extent than just like digging into a tissue with your thumb.
And one of the other things that happens when we do this treatment is muscle twitches. Oh.
Yeah.
And oftentimes when it's happening, you're like, oh yeah, there we go. I'm dying
right
on the table. Yeah, whoa, that's a weird one. That one shoots up into like my fingers. And you're like, oh good, yeah, we're getting some flexion going there while I'm getting the pinch of the needle at the same time. So what makes that like part of the treatment? Like why, that's what you're looking for, I guess, is that muscle twitch?
Yeah, so but the whole theory and philosophy entails this neurodynamic, so neuromodulatory effect. When you go in there and you get that twitch, that's called a local twitch response. And that tells us that we've just tapped into that reflex arc. And now it's just like reflexively contracting basically. And that tells us we're right on the muscle belly we want to. We're causing the release that we're looking to cause. And it sort of fits the theory quite nicely. You can go in theory, and go into a muscle and not have the twitch, but have a bit of an ache, and it still sort of gets it. And what I see clinically is when you have a bigger twitch, you have a greater effect, and it sort of helps. And you've probably noticed too, as we've gone into the weeks, it's become less intense. The recovery for you has improved, and that's sort of showing that like this reflex arc is now changing, and the response we're getting is a bit different. Obviously too, you're more familiar with it, so we're not going to throw that out the window too. Like you're much more familiar, so it's not as intense. But what we experience is becoming less and less, so it's changing as you go through.
And one of the things I asked you too about this was, when should I be training around this? Because then I'll talk to other people that get treatment from wherever, you or somewhere else, and they will complain about like the muscle soreness. Ugh. Yeah, the quad was the worst today. Sure. I'm going to be feeling that tomorrow. For me, it's similar to having like delayed onset muscle soreness, DOMS, from lifting weights or doing too many jumps. And I think you've said before that probably not a great idea to exercise right after. So what's like the window if someone were going to get this treatment to treat a tendinopathy? What's kind of like the window of time that they need to wait before training after treatment?
Yeah, the idea behind it when it gets fairly intense and quite achy is that you should be waiting at least a 24-hour period. So if you get needling done, Monday morning, your Tuesday afternoon is when you're going to train again. So that whole day, if you can sort of tinker your training with an off day, that's kind of the best way to go. I mean, there's
so
nothing
if it's still sore, like that would be, like if you still have some muscle soreness, it would be okay.
Yeah,
24 hours after.
In theory, if it's still a bit achy, you'd be okay. If you could wait 48, at that case, if it's your first time around, it'll be worse. So if you're down towards your 4th, 5th treatment and it's not as bad, I think 24 hours is a bit better. But if it's still giving you some ache, maybe hold off if you can. But if you can't, your scheduling doesn't allow it, it's not a bad thing to do.
Right.
But sometimes, I mean, the theory is to wait longer if it's still giving you lots of trouble. But it's not viable to get treatment and then wait 3 days to train again. Okay. I mean, if you can.
I guess the last thing I want to ask is, you weren't always using this treatment method.
Yeah.
So tell us a little bit about like when I guess you first started catching wind of it, or when you learned it, how that happened, and when you actually started to realize, okay, people are getting an effect out of this, so you're going to start offering it more.
I mean, when I first started doing it, or when I first got into physio, all the physios I looked up to had sort of used this method. And at the time, it was strictly Chan Gun IMS. It was a technique developed in Vancouver. So everyone from around here had been using it, and people you looked up to, and people who are in the community that were really responding to treatment were doing Chan Gun IMS. So I wanted to go in and do it. However, you have to have 4 years experience before you can apply to the program, and some additional continuing courses that you take as a physio just to apply and get into the program. So I didn't get into it, unfortunately, until 2017. I got certified, went through the whole process. And that was great. You go in and you do your course, and you go through a couple weekends, you do all your things that you need to do and all the additional coursework and reading. But then you have this new tool. So clinically you come in and you know that you can use this method, but you don't really know how to apply it. So for years, if you'd been working on, say, Achilles tendinopathy or something, you'd have your experiences that you do. So it wasn't until I was sort of worked under some other therapists that used it and sort of gave it a shot myself that I was finding that people were getting better much faster, and seemingly with less effort on my part as well. So in terms of like really drilling into the tissues and trying to work on it and spending 45-minute sessions just digging the calves, you can spend the time education about what to do the needling. It's going to hurt like a bugger, especially the first time. The person's going to limp around, they're going to hate you for a couple days. But then day 3, 4, 5, they realize that it's not nearly as bad as it was, and all the work that we've been doing before was good, but it didn't really apply. So it took some time to have enough cases and work with it before you start realizing that is quite effective. The other thing too is you have people coming in for physiotherapy, and they're looking, traditionally you know what physio is, going to be working on tissues, work on the joints, some exercise prescription. So someone comes in and it's a bit of a thing. It's, oh yeah, we're going to stick this 40 mils of cold metal into your thigh. And, what? So you have to kind of get used to that idea and understand the person, what they're into. So not always you have someone come in and you go to this method or modality because it might not be appropriate for their beliefs and understandings. You can talk about it, and if they're interested, then you can explore it a bit more. If not, then do some other things. But that's kind of how it came to be, and you start realizing that it's really effective, for tendinopathy, tendon type pain, and sort of chronic-y postural pain syndromes. It does a really good job.
All right. Well, I'm going to jump into this now, but thanks for tuning in. Again, this is Ian. You can visit him right here at Origins Parkour, although you'll find him at rangephysiotherapy.ca. Remember to hit that like button, subscribe to the channel. Let us know if there are any other questions regarding physiotherapy, particularly as it relates to parkour, that we could collaborate with Ian on. And we'll see you next time.